afternoon, folks. I'm Adam Shanley, the Empower Programme Manager at HIV Ireland. You're all very welcome to this community discussion on monkeypox, organised by Empower in collaboration with Mandalay, the HSE, and facilitated by the gorgeous folks at GCN and their very slick streaming technology. We have a busy hour planned with lots to get through. So we'll speak to some of the people leading the monkeypox response in Ireland. We'll have a chat about symptoms and transmission, testing, prevention, isolation, vaccination, everything that we can cram in. We'll also hear from two fabulous fellas who are very generously sharing their lived experience of having monkeypox. So we're looking forward to hearing from them. I want to update everybody as well very briefly on the resources that we've developed and what we have in motion, but also to kind of put it to you and ask what else you think is needed that we could produce. So I'll put that in your minds from the get-go and have a think about that. And then finally, we'll have time at the end for questions and answers. So please do post your comments and your questions in the chat function, and we'll get to them. This is it's a live stream event on Facebook and on YouTube. So you may be watching this back, and if you are, thanks for tuning in. But just be aware that any comments that you make, we won't see them. So if you do want an answer, feel free to reach out to us on socials or through the Empower website. But for those of you watching live, we do encourage you to post your comments and your questions, and then we'll come to them at the Q&A section at the end. On that though, I'll remind everybody that, you know, that's commenting to be kind and be respectful, both to the speakers and to each other. Homophobic, transphobic, racist, or any kind of hate speech or hoax talk of any kind just won't be tolerated. We're holding this space for the next hour so that we can listen and we can learn and we can share, and so we can take informed action in the days and the weeks and probably the months ahead. So that's that said. I'd also like to mention that because it is a public event, we do expect some media to be watching in. So if you're from the media, hello, you're very welcome. We appreciate your support in bringing attention to this issue facing our community, but we do ask you to do so sensitively and appropriately. We will have guys sharing their personal lived experience of monkeypox during the event, so please don't use their names without their express permission, and you can feel free to reach out to us at Empower for that. So just before we speak to our guests this evening, I wanted to offer a genuine great deal of love and gratitude to everyone working really hard in the response to this outbreak. Our epidemiologists, our public health, sexual health, and in particular clinicians and healthcare workers in our sexual health services. They're our first port of call for monkeypox, but they've also been dealing with a hell of a lot in terms of COVID waves and syphilis outbreaks and your day-to-day sexual health care, all on a shoestring budget. But they're answering yet another call to arms. And I just want to make a point of thanking them for what they do. So we see you and we really appreciate all that you do for our community. Thanks also to colleagues that we've been working with in comms and man-to-man and HSE and HPSC. It takes a real team effort to respond in the way that we have been. And it would be completely remiss of me not to give a big shout out to my Empower family, colleagues at HIV Ireland and our fabulous Empower volunteers as well, guys who have been giving up so much of their time to attend training on work on monkeypox, to throw on an Empower t-shirt and head into our bars and clubs and saunas and other community spaces over the last couple of weeks to raise awareness about monkeypox. It's not easy to approach groups of people in social spaces like that, but it's been a really invaluable part of the response. So thank you. And look, finally, I want to thank all of you for tuning in. Being here means that you care. You want to learn, and it means that you want to be part of the response in ending in this outbreak. So thank you for being here. So look, that's enough from me. I think it's time to bring on our first guest, which is Professor Fiona Lyons. She's Medical Director and the Clinical Lead for Sexual Health in Ireland. So Fiona. Fiona.
Hi, Adam. Thank you very much. And hi, everybody. I can only see Adam, so I have no idea how many other people are on the call. Thanks a million, Adam. And thank you. There's not a lot of thanks being said so far. Thanks for the words of appreciation for what we've been doing. I mean, it's our pleasure we all care. People who are in STI services love sexual health. So it's our pleasure to try and respond to this appropriately. I will acknowledge we are all a little bit tired, like everybody is. But we'll rise to the challenge as we've done before. So
we really appreciate it. Thank you, Fiona. Look, I guess we'll just jump straight in, and I suppose maybe starting with a bit of a Monkeypox 101. So you might start us off with, what is monkeypox and maybe what are the symptoms to be looking out for?
So Monkeypox 101. Well, I suppose if you'd asked me this question 3 months ago, I probably wouldn't have been able to answer very much of it, other than it was something that I had no experience of. I'd never seen somebody with monkeypox. It had never entered into something that I would consider. If it was somebody walking in to see me in clinic, it would never have been in my thought zone at all. So it's a virus that up until the middle of May was primarily seen in African countries. As I said, I had no experience of it at all. And then the landscape changed quite suddenly in the middle of May when it was being described, as we know now, across European countries, first of all, in gay, bisexual and other men who have sex with men, presenting with unusual rash. And then it became apparent that this was monkeypox. Since then, I suppose the textbooks have changed a little bit, and that in the big, if I was to pick up a medical textbook and say what it says about monkeypox, as somebody who'd never seen somebody or considered it in somebody, it would have been a case of describing an illness that has two phases, where somebody feels like they've got a virally symptoms with fever, a little bit of tiredness, muscle ache, the usual things that we might experience if we have a viral illness, and then subsequently they may develop a rash. But I think our really steep learning curve that we've had since the middle of May has shown us that the virus is presenting in our GBMSM community in lots of different ways. So at one end of the spectrum, we're seeing individuals who may have one single lesion and that's it, right up to, and may have had no symptoms of fever or tiredness or swollen lymph glands that are described by others. So that might be at the very, very mild end of the spectrum, right up to people having lots of lesions, some of which can be really painful and feeling pretty rubbish at the same time. And we've seen people with different presentations in between. So I suppose one thing that I wanted to make sure that I said early on was, so we have our experience is growing of looking after people with presenting with monkeypox. Thankfully, thus far, we haven't had anybody who's been really seriously unwell. We have had people who've had a very uncomfortable illness, but their life hasn't been in danger, which is good. And I think the experience of what's happening currently around the world is that lives generally haven't been in danger, but many people have had a pretty miserable time with their monkeypox illness.
Yeah, I think that's really important to note. I think when we started, doing any kind of awareness, we were kind of presenting it as a mild illness, and I suppose there's a kind of whole spectrum of what people are experiencing, from, like you say, having maybe one lesion that then disappears, all the way to being, very painful. But thankfully, the good message there is that nobody is, it's not been fatal for anybody so far. So you're talking about those symptoms there. When would you recommend someone should seek a test for monkeypox, and how should they go about getting that test?
So I suppose if somebody recognizes that they may have had a risk that put an potential exposure to monkeypox, then and they get the symptoms, like where they get a rash or an unusual looking lesion that doesn't stack up to something that they've had before, if they feel unwell and they're concerned that they may have had contact to present to their sexual health service, probably to their sexual health service if they can, or to make contact with their local sexual health service, because if their local sexual health service isn't actually able to provide the vaccine or the assessment and testing, they may be able to put them in contact with somebody who can. And thus far, most of the cases that have been diagnosed have been in the Dublin area, and clinics in Dublin have built-in capacity to provide assessment and testing. So when you say come forward for testing, not everybody necessarily, Adam, who has an assessment will need to go forward for testing. So we're trying to make sure that we want to have the country's approach to testing has been having it being very sensitive, that we will actually be able to identify people who have monkeypox, but not everybody who feels they may have it may need to go forward for testing, and that's a learning thing for us all at the moment as well. So and the other thing that we've done in James is a lot of telephone contact with patients, a lot of time on the phone. Some people have been happy to submit images, which has been done in a secure way to help us to have a look at them. For some, that doesn't work out at all, so it's the policies and procedures that we put in place have been adapted several times in the last few weeks as we try to build capacity to meet the needs and the demand within the community for assessment and testing.
It's a really dynamic situation. You mentioned about if someone feels they had a risk event. Could you tell us a little bit about that? Like, how is it transmitted?
So we know close body contact is enough, and is an important part of somebody potentially coming in contact with and acquiring monkeypox infection. So in the context of what we're seeing right now across the world, it seems to be intimate skin-to-skin contact so genital contact, oroanogenital contact is of importance. What isn't known, and so if somebody has the very virally symptoms with feeling like they have a cold, or they might, if they have lesions in their mouth, they may actually transmit through a cough as well. But so close contact for some individuals through coughing, if they have those symptoms. The unanswered question at the moment is whether or not it's actually sexually transmitted, as in, can it be transmitted through semen, for example? It has been identified in semen, but that doesn't necessarily mean that it is transmitted through semen. And that is an unknown entity at this time. And I suppose that's why, in terms of for people who are recovering from monkeypox, the current recommendations around suggesting that individuals might adopt a precautionary approach, that if it is actually transmitted through semen, that you allow a period of time after somebody gets better and use condoms to prevent transmission through semen for a period of up to 12 weeks after somebody has had monkeypox.
Okay. So look, we know that there are vaccines, and we'll talk about that in a while. But what about treatment? We don't really hear much about that.
So treatment, like many viruses, treatment is often supportive. So if you've got aches and pains, making sure you stay well hydrated, analgesia. So there's sort of the general principles of looking after somebody who's got discomfort, and looking after yourself if you've got discomfort associated with a viral illness. There are specific antiviral medication that have been used for patients who have monkeypox infection, and we are working through with the incident management team and across the HSE and within the Department of Health around identifying getting access to antiviral medication and identifying the people who would most benefit from antiviral medication. All the indications are from colleagues who are a little bit ahead of us on their monkeypox journey, suggest that it is a very small proportion of the individuals who have monkeypox infection who will need specific antiviral medication, somewhere between 1.5% and 2.5%. So that's reassuring. And I mean, every avenue has been explored to ensure that we have access to that medication if we need it for an individual, or if an individual needs it. So the supportive stuff, the specific antiviral stuff, but then some people will, if they've got a large number of lesions that start to join up or coalesce, as we say, they may get a secondary infection, especially if it's around somebody's bottom. It may be difficult to keep that clean. They may get a secondary infection. So some people will need an antibiotic. The other really important thing to bear in mind is that we have seen that for people who have monkeypox, they may have another infection at the same time as well. So that needs to be in the back of our minds when we're providing care to people who are being assessed and looked after with monkeypox infection. So they may have something like chlamydia or gonorrhea or syphilis at the same time.
There's lots to keep in mind. I might add Natasha into the conversation now. Natasha Rafter is a specialist in public health medicine and works with the Health Protection Surveillance Centre. Welcome, Natasha. We've been chatting there to Fiona about monkeypox generally and what to look out for. But can you give us a bit of a context? We're about 2 months into the outbreak. Can you give us a bit of context what the current situation is in Ireland?
Sure, Adam, and thanks for inviting me on, and hi to everyone. So I work at the Health Protection Surveillance Centre, and we're a part of the HSE. We're the bit that collects information about infectious diseases, all sorts of infectious diseases, monitors them and sort of analyses that data. So labs and clinicians like Fiona report to us called notifications of infectious disease. So we've had 85 notifications of people diagnosed with monkeypox in Ireland, and that's been over the last 8 weeks. All of the notifications of the people have been male, aged between 19 and 65, with an average age of 38. We know the sexual orientation of about 80% of the people, and all of those have identified as gay, bisexual, or other men who have sex with men. We're part of a multi-country outbreak, as Fiona was saying, mainly in Europe, North America, and the UK. And there's been, I think, nearly 19,000 cases reported now across the world. So we have 85 of those.
Okay. And so when someone, so we've got 85 people that have been diagnosed with monkeypox in Ireland so far, and they can all expect a call from public health at some point. And that's with the aim of contact tracing. Can you give us a bit of an idea so that people know what to expect should they get a diagnosis of monkeypox, what that process would look like?
Yeah, so the departments of public health undertake contact tracing for a number of infectious diseases. So monkeypox is one of those. And if a person's diagnosed with monkeypox, they'll get a call from someone in the department and asking them for their contacts while they were in their what's called their infectious period. So people with monkeypox are infectious from when the fever starts, when they start to feel unwell, as Fiona was saying, or if they don't have a fever, from 24 hours before the rash appears until when the rash is healed. So public health will ask the person who they were in contact with and what type of contact they had, because that's important to sort of work out whether a person is a high-risk contact, and that's probably someone who's a sexual contact or shares a bed with the person with monkeypox, or an intermediate risk would be other household members, or a lower risk contact might be someone who's had sort of face-to-face contact for a reasonable period of time. So people are then contacted by the departments, and they're told that they have been exposed to monkeypox through contact with a person with monkeypox. They'll be asked to monitor themselves for signs and symptoms of monkeypox for 21 days from when they were exposed. And there's a form to fill in to help them, and they'll have to take their temperature once or twice a day over that time. Now, if the contact develops signs or symptoms, then they will be able to call public health and a test will be arranged. So all this is to reduce the transmission of the disease, to identify new cases early and make sure the new cases don't spread the disease or the infection on. And people who are sexual contacts will be asked to abstain from sex for that 21-day period as well.
And those people, so you were mentioning about to kind of monitor themselves. Are they asked to just monitor themselves? Are they asked to isolate? What's the story there?
So there will be a sort of assessment on what everyone's individual situation is, but mainly people, if they've got no signs or symptoms, will be able to continue as normal. But there may be some cases where isolation will be recommended. And it might depend on whether they're able to what sort of living situation they're in themselves, actually. And in general, high-risk contacts and other contacts will probably be asked to keep away from people who are susceptible to like really severe disease, which would be pregnant people, immunosuppressed people, and children under 13.
And those high-risk close contacts, they might be offered a preventative also, right?
Yeah. So I almost forgot. Excellent. Thanks for reminding me. So high and intermediate risk contacts should be offered a vaccination, and that's called a post-exposure vaccination. And that will be as long as their sort of last contact was within 14 days, because that's when the vaccination is most effective at preventing monkeypox.
Fab. And so we kind of touched on isolation there a bit, and that's obviously a really important part of stopping onward transmission. How long is isolation? What are people asked to do?
So this is now talking about people with monkeypox
who've been diagnosed. Yeah. Yes, sorry.
Yeah. So they are asked to isolate until their rash is healed. And they will be talking with people like Fiona, whoever's looking after them with respect to their monkeypox infection. They'll be talking with them to make sure that the rash has completely healed. They haven't had a temperature in the last 72 hours. They've got no lesions in their mouth. And if the doctor is happy that the infection is finished, they're not infectious to anyone else, then they can exit their isolation period. On our HPSC website, we've got a leaflet about how to isolate. It's a bit similar to, isolating with COVID in those early days, staying in your room, window open, using your own bathroom if you can, and, washing your own clothes and bed sheets, and using your own kitchen utensils. Again, keeping away from people who are at risk of severe illness. So the pregnant people who are immunosuppressed, and young children, and actually avoiding contact with pets as well is another thing for self-isolation.
Great, thanks. And then I'm going to go in with the hot topic question. So, look, we've had news obviously from NIAC and the Department of Health yesterday about vaccination. And a lot of work has gone into getting that recommendation, and a lot of work will now need to go into a vaccine plan. What can you tell us about vaccines? Yeah,
so this is good news, really good news. I think exciting and fresh news as well. So the National Immunisation Advisory Committee has recommended that vaccination should be offered to people at high risk of getting the infection. So this is pre-exposure vaccination. So that's different to the people who've already been exposed and identified as contacts. One of the big issues that we have at the moment is that vaccine supply is low and limited in both Ireland and the EU. So the HSE, the incident management team we've been set up, the National Immunisation Office, Department of Health, lots of other people now need to sit down, review that recommendation, work out how to identify the people at high risk. And that will include members of the gay, bisexual, and other men who have sex with men community, and others that are at high risk of unprotected exposure. So we need to work out how to identify these people and how best to use the vaccine supply that we have. So that there's going to be a lot of work going on to do those things.
A tricky task. I'm sure that I can see that there's questions coming in on the comments there, which is great, and we'll definitely get to them at the end. But for now, I want to thank both Fiona and Natasha for their time, and we'll see you back at the Q&A. So now we might jump into having a chat with Haroon. Haroon and Stevie might join us as well. We're going to have a chat about the kind of lived experience of having had monkeypox and how they've navigated that. Hi, Haroon. Hi, Stevie.
Hey, Adam. How you doing? Nice to be here. Thank you.
Hi, Adam. Nice to meet you, and thank you very much for having me over.
So this is the exotic international section because we're coming from Cyprus and Berlin at the moment, I think, right?
Yes, I'm at Cyprus, and my apologies for this dark room, but my hotel room is quite dark, so I don't have enough light up. But it's Cyprus, yes.
You get the heat, we get the light.
Yeah.
So look, I'm going to kick off. Haroon, you're one of the first people to speak very openly and honestly about your monkeypox experience. You used Twitter and other social media platforms to really kind of raise awareness of the reality of it. What motivated you to share it? And what will you walk us through what it was like for you having the virus?
Thank you very much for the question, Adam. When I was at the hospital, obviously, when you are lying on the bed in between four walls, where you cannot, do anything, you have lots of time to think. And when if people read about the story, how I was diagnosed, it took a while, and after lots of wrong diagnosis, finally it was found out that I got monkeypox. So it was a very scary start for me. So I have ADHD, and unknowns are quite scary for me. I would like to know the path and what is going to be happening next. I didn't have that opportunity until I was already at the hospital, and on the third or fourth day, I think I got the positive result for monkeypox testing. And until at that point, it was a huge unknown, and it was mentally very draining. And I thought about the past, and especially about HIV journey, 30, 40 years ago. And it just obviously, we always think about the difficulties back then, but it really, made me aware the challenges, actually, the difficulties of unknown. And I just didn't want to really for other people to face this unknown by themselves, because as I learned a lot. There's a vaccine, there's a treatment, but nobody knew. I didn't know about that, and nobody knows about it. And I just wanted to put myself out there to tell people that actually, how the journey is. Because also we know from HIV, how peer support is important, because lived experiences are really empowering other people and help them to take control of their own lives. So with the unknowns, rather than scaring people with confusing messages, I just wanted to show them how it feels like. And also I wanted people that I thought, I was going to die, and I thought that it was really severe and painful. And we don't know who is going to get it severe and who is going to get hospitalized. So I just wanted to remind people to be considerate and kind to each other, and just be cautious about it, because it may be dangerous for some. That is the main purpose that I put myself out there.
Well, thank you. We're really so appreciative that you have. You're usually based in London, right? You're in Cyprus. Yes. on a jolly. So you were hospitalized, right?
I was at the hospital for 11 days. So it started at the beginning of June, and around 10th or 11th of June, I think. And I was at the hospital for 11 days, and then I isolated for another, I think, 2 to 3 weeks. Like Fiona said, until all the scabs are healed, or the scars are healed, and my body was full, intact. So in total, I think a little bit more than a month my monkeypox journey took.
Right. That's important to know as well. So you recently got out of isolation, and you started seeing friends and going into the office. What have people's reactions been like?
It was actually, again, another unknown for people, Some of my friends, some close friends, were really hesitant to meet me when my doctor told me that I can go out. I was also a little bit hesitant as well, because, the researches are still going on, and I'm a huge man of science. I believe in science. And And I was reading, and there wasn't, some information is changing from one source to another, and I didn't want to risk anyone by exposure. But still, it kind of hurts when you can't see your friends, especially after isolating and being cut out for more than a month. But I also understand the concerns as well. Because they don't know and I don't know. I know everybody told me that I was safe, but luckily enough, I got confirmation from both from my sexual health clinic and from the hospital I was in, and yeah, it got better. But I have to say, what kept me on is like going on this journey and the share and gave me the power is actually the support from the community, because our HIV community and gay, bisexual, and MSM community sent me lots of messages. Even when those times, when I got out of the isolation, I was a little bit down because I couldn't see anybody still. People were hesitant, and they, messaged me and gave me moral and keep me up. And I have to thank to everybody who supported me actually.
That's fabulous to hear. Fabulous. I might put the next question to you, Stevie. Can you, an Irish lad in Berlin, can you tell us what prompted you to get tested, and how are you doing now with symptoms?
Yeah, so on Monday, the 11th of July there, it was kind of like late into the night, like evening time, nighttime, I thought I had herpes symptoms on my anorectal region. So I started to take some aciclovir, which I have at home. And the next day I was out meeting a friend and I said, I'm really not sure if this is herpes. I'm going to keep taking the tablets, but I'm just not sure. And then I got home that night and I had a text of somebody who I had been with a few times in the weeks before that. And they had traveled back to their home country and they said, look, I've been tested positive for monkeypox and I've had a rough time and I think you should get tested. So then I kind of knew, right, it's not looking good. So I went to my doctor the first thing the next day and my doctor confirmed that it was. And then the results came on the Friday. So kind of like knew from Tuesday, but then, my doctor confirmed. And then on Friday, it was like, on paper or whatever. And I think that's when it kind of hit me. And I was kind of looking for resources online, but it was kind of hard for me to find anything really like that was, really guiding me in any way in terms of isolation, what I can do, how I can treat it. I reached out to yourself, Adam, about like putting something online. I was a bit nervous. I didn't really know what I should do. And I put a post on Instagram, which was more to find other people who were in the same situation or who had experienced it, because I knew that there was people in Berlin anyways who have probably gone through it, but they just haven't shared about it. I think I seen one person sharing about it on Instagram and I just thought, okay, it's a different ballgame to COVID. Like people were, in COVID, people were uploading their pictures of their negative tests or their positive tests. And, it was a whole thing. Whereas I just felt like this was really in the shadows. No one was really talking about it. No one was really addressing it. And that wasn't really a nice place to be in, and I'm really glad that I reached out to you and that I kind of had the courage to put something up. Everyone has been so supportive. I just have been really moved by people reaching out and just, doing whatever they can to help me through it, whether that be chatting on the phone or, getting me bits in the shop or whatever, and yeah, that was a rough weekend. I thought I was kind of okay, but Saturday night I just had excruciating pain. Going to the toilet was excruciating. Couldn't really sleep that night. Couldn't sleep Friday night. Mixture of like discomfort and just emotions, very emotional. Sunday was another just day and night of like pain, and it kind of died down then come Monday morning, but I went straight to my doctor because I knew I needed stronger painkillers than what I had,
Right.
So since then it's kind of been last week. Then I discovered lesions on my body, so they haven't been sore or anything. I've just had to take care of them with plasters, and in the 10 days or so since they appeared, they've gone down considerably, and I hope they'll be gone in a week or so.
And has the main pain, has that passed?
Yeah, that's thankfully subsided.
Right.
Yeah, it's and the discomfort in my anal rectal region is gone now, thankfully. And yeah, I've stopped taking any painkillers for about a week or so now because I just didn't feel like I needed them. So yeah, happy with that.
Well, thanks for sharing that. It's really important, I think, to hear that there's such a spectrum of people's experience of monkeypox, which is probably even going to make things kind of more tricky. People that are having very kind of a discrete symptoms, that's going to be difficult for us to identify. But it's really, really important to hear, how it can feel. And I guess what I'm struck by is how, this sounds a bit silly, but how isolation is, and how isolating it is that, you're on your own and experiencing all of these things. And you've cited how important it is to have connection to community. What helped you through that period and this period?
But again, because I think on the fourth day, I started sharing the journey on Twitter. And then that kind of kept me going. I just wanted to give most accurate information to everyone. And that really kept me going. And I was really trying to be careful about what I am sharing. And because I didn't want to scare people. All my goal was, to inform people and to tell them that, to be kind and to be supportive. And I saw lots of kindness in return. And it kept me going because every time I was very hesitant at the beginning. And every time when I got, when I received a positive feedback, or every time when somebody asked me a question and when I answered it and they learned something or they understood it better, it just kind of kept me going, thinking that, okay, at least we are sharing the information and I can see that on other people as well. So that really kept me going. Also, obviously, the support, especially from my workplace, Positively UK colleagues, they really every day almost they checked on me, and my friends, they checked on me every day, messaging. But again, it's like because you're in the hospital and isolation, it doesn't feel like I just want to go there and hug them or have a drink outside, but I can't do that. But still, they were sending me lots of love and nice comments every day, so that really kept me going. So yeah,
that's fab to hear. Stevie?
Yeah, the same. Just it was really good to chat to people who have been through it, and just kind of to know what to expect and to know that there is an end point. And then just the support and the care and the love that I've received through my friends, through like people who I haven't even met, like we just follow each other on Instagram or whatever, and just like I was just moved each time, and it meant so much to me. It was just a really, really hard time for me, and I'm just so glad to be through the worst of it now, and I'm just so grateful for the support that I've received.
We're happy for you too. Thanks so much for sharing, Haroon and Stevie. I think you've highlighted, that we, as the gay community, we really need to step up the community part of it. For those that are going through monkeypox, and I think we have a really strong, long legacy and history of caring for one another and stepping up to the plate when we need to. So thank you so much for sharing your stories, because I think that's a really important part of it, getting that message out to our community that our community is in need of love and care at this time. So thank you very much,
Okay.
both, and we'll see you back in a few minutes. So I'm just going to take a quick minute just to talk about what we've been doing on Empower. We've obviously created a big awareness campaign that we collaborated with Man-to-Man and the HSE on. And that's been going out on social media and Grindr and all the rest. We've been, as I said at the start, mobilized a bunch of our Empower volunteers, trained them up on monkeypox, and got out into the community to do some outreach. But we're also constantly looking, and I guess the foundation of Empower is to respond to the needs of the community. And I'm really, really asking everybody on the call, everybody watching back, to have a think about what it is else that we can do. I'm hearing definitely from the experiences of Haroon and Stevie that it's really important for us to have some mechanism of peer support, and that's something that we'll definitely look into. We're in the middle of making a kind of a managing monkeypox manual, a bit of alliteration, and that's kind of, I guess, trying to distill all of the dense HSE documents about what isolation, condom recommendations, how to clean your house, all those bits that are kind of dense and kind of disparate. And we're going to try and plot that down into a kind of an easy to read guide of managing monkeypox. But if there's other things that have come up for people that are going through monkeypox or from the outside looking in, do let us know, because that's what we're here for. And we want to make sure that we're responding to the needs as they arrive. So please do, if in the comments, or reach out to us at Empower. We're here to respond to your needs. So that's the Empower pitch over. We have I think a good load of questions in the chat box. We might bring everybody back that was on with us. Hello again. Listen, thanks everybody for all of your comments. We've about 15 minutes to the hour, so we should be able to get through things. First, I'm going to kick off with Phil Corcoran. Hi, Phil. Phil's down in Sexual Health Centre in Cork. He has said, can a person get monkeypox more than once? Fiona.
Probably, but I don't know. So I don't know. It's a little bit like, we didn't know when we got COVID in the beginning, we weren't sure how long the past infection would offer us protection in the future. So it's probably variable. So I don't know the answer to that question. I would hope that if somebody has gone through the experience, and thank you to Stevie and Haroon for sharing their story. I think it's a really important part of us understanding, for clinicians as well, what people are going through when they have monkeypox infection. We don't know how long the protection will last after you've had an episode of monkeypox. So some people will probably get very long, and some people may not get quite so long. So I don't know the answer to that question. And I think that goes on to Tom's question, the next one down, Adam, about are you already inoculated? Yeah, I think that the reality is that for those people who have had monkeypox, that you probably have developed some immunity that will hopefully confer benefit to you in not getting infection again for a period of time afterwards. But how long that lasts, we don't yet know. And there are probably multiple factors that contribute to that, both virus factors and the individual factors.
Thanks, Fiona. These comments are all jumping all over the gaff. Hold on. So Andrew Hyland. Hi, Andrew. What's your advice for folks holidaying abroad this summer? COVID and monkeypox makes for a sobering holiday.
Do you want me to speak to that, Adam?
Yeah, go for it.
Well, I went to Barcelona in June. I can tell you I won't be rushing back to an airport anytime soon. The experience wasn't great. Maybe I'd never like to fly to travel anyway. I think it's a really hard time because we've had 2.5 years where, we haven't left for many of us haven't left our little island of Ireland, and, to get away, we're all dying to get away. So I suppose, to make an individual assessment of the risk of COVID and the risk of monkeypox, and then decide yourself what best to do and have yourself as informed as possible. And in the event that you run into problems, seek help. I mean, I don't think anyone can tell people what to do, but I think it's really important. And for us, such as this, is to help people to make informed decisions about what they're going to do. I think if somebody has an underlying condition and they're caring for somebody who has an underlying condition and they're the primary carer, or for whom getting monkeypox was going to be a really big deal, then, you know, I think for me personally, I would probably not travel, but that's obviously, none of us can say what's going to suit for individuals and their individual circumstances.
Yeah, I think that's really important. I think do's and don'ts are difficult. I think it's more about informed choice, really, isn't it?
Yeah, I think so.
We all make our own kind of choices around the risks that we are willing to take. Thanks for that, Andrew. I did skip one there. Where a big question: where will vaccine be available, and is it recommended?
So I can speak to that if you like. Will I, Adam?
Yeah, go for it, yeah.
So is it recommended? So I think the Minister for Health issued a statement yesterday that the National Immunisation Advisory Committee were going to make a recommendation that it should be available to people who may be at risk of getting monkeypox through the community. And so that is the National Immunisation Advisory Committee recommendation. That hasn't been published. That their recommendation hasn't been published on their website as yet. Suffice it to say, I suppose that from when we got word of that yesterday, there've been a lot of meetings to work out how best to get as many vaccine doses to as many people in need as quickly as possible. And it's a very dynamic situation. And I don't mean to sound fluffy or avoiding the answer to the question. Is like, it is moving very, very quickly. And many, like Adam, Natasha, and myself and others have been on many meetings yesterday and today talking about this, and more planned for tomorrow. So we won't be behind the door and coming forward when we have more information on this.
Thanks, Fiona. Really great question from Chris Noon. Hiya, Chris. Good to see you. Well, kind of. How can we support people who need to self-isolate due to monkeypox? Really concerned for those who can't work from home or those living in shared accommodation like direct provision. Yeah, Natasha, go for it.
Yeah, sorry, my internet's been dropping out a bit. Apologies for that. I might have missed the last few questions. So I think to highlight that when you get diagnosed with monkeypox, if there are going to be issues, important to highlight them with your doctor and with the public health people that call, because there are supports out there, and there may be a place that you can isolate. So I think it's good to talk these things through, and it's on an individual basis, really.
Yeah, I might add to that, Chris. We're actually working closely with the HSE at the moment to try and with a funding proposal for kind of psychosocial support, some kind of structured support, because people are finding themselves in some very difficult situations, depending on their personal circumstances, their relationship circumstances. All that comes from maybe acquiring monkeypox and the impact of 21 days or maybe longer. So we're on that, definitely. And as Natasha had said, in terms of, having monkeypox in a kind of congregated setting like direct provision, there is provision for isolating in other spaces. Fiona, did you want to come in there?
Yeah, I just wanted to say that, I suppose, so we have been looking after people in the community. So in our unit, very few people have needed hospital admission. So we've been looking after them in the community. And so our part of that is actually assessing kind of how are you doing as well, you know what I mean? So when we will be calling patients to see how they're doing, clinically, like to see, are they getting new lesions? Have they got a lot of pain? Do they need additional support? Are we going to need to bring them into hospital? But part of that assessment is, well, actually, how are you doing? And because some of the people that I've been in contact with have been quite isolated outside of Dublin, with very few people to speak to. And so we've stepped into that role of offering some support over the phone to people that we've been seeing, particularly at weekends when generally things have been quieter for people when they're in isolation, whilst other people have been out and about.
Another question here from EG. Does the vaccination prevent an individual getting monkeypox, or does it more so prevent the symptoms of monkeypox? So does it reduce the kind of illness?
Really good question, EG. Is that okay for me to answer this question, Adam? Yeah, really, really good question. I think before now, there's not a huge amount of information around the role of this smallpox vaccine for monkeypox. So the WHO in issuing their guidance around the role of vaccine have said that we actually need to really monitor this to better understand. So I would say there's probably two elements to it. One, that it can confer benefit in terms of preventing somebody from getting the infection at all, but also a little bit like we have hoped has been the case with COVID, that if you do get the infection, that it may not be as severe. But there are plenty of unknowns in that. So I think that an important part to inform future responses and to make sure that we do the best by the people who are entrusted to our care and to the population is to understand what happens to people after they've had the vaccine. Does it confer benefit in terms of preventing, but also in terms of making the illness itself less severe for folks?
Thanks, Fiona. I want to bring in Haroon and Stevie on a question that's come in from Noah Halpin. Hi, Noah. What is the best way we can support our friends who might be experiencing monkeypox? What are your thoughts on that?
Stevie, do you want to go?
Yeah, sure. I guess I would say just check in with them regularly, voice notes, calls, texts. Yeah, I mean, personally, I prefer to hear a voice rather than getting a text. But yeah, by whatever means, I think it just, just to reach out and ask them if they need anything. Do they need anything picked up in the shops? Do they need any bits brought over, and do they need to chat about how they're feeling? Like, is there, emotions or feelings that they're having, not having the contact with people and with the illness, like how they're feeling in their body, that kind of thing, yeah.
I will agree with Stephen. Also, on top of that is just knowing that, just comforting them. I think hearing, like Stephen said, hearing someone else is really, really good. It's not the same thing to meet someone face to face though, but still, you can see having a video call. I had friends from Turkey calling me on the video every day, so it really kept me going. And also because it's an isolation, maybe lots of movie advices would be good as well, because you may end up finishing everything on Netflix. So so that kind of advice is also very, very welcome. But just know that it is not something that is not fatal. There's not many cases, only 7 I think in Africa back then. But so rather than the panic, just being supportive and knowing the facts, I think that's the best support.
Thanks, Stevie. Thanks, Haroon. We're coming close to the end. I want to see if there's any. There's just lots of comments here, and this is not my. Is there any issues with getting? This is Alan Fogarty. Hi, Alan. Is there any issues with getting COVID vaccine and monkeypox vaccine in a short time frame? Should I leave a gap between?
That's a really good question, and we will get back to you.
But I might jump in. I had right after the monkeypox, I had my COVID vaccine. Even when I was on treatment for tecovirimat, the 5th vaccine, and it is fine. I was told, just sharing an experience.
You're alive and kicking. Okay, fab. Well, look, there's still tons of questions in there, but we're coming up to the hour now, and I just want to give an opportunity. If there's any kind of final comments or anything that people want to share, or a message that they want to get out before we head off that we might not have gotten around to from the panel. Does anybody have any parting thoughts or comments? Fiona.
Can I just say thanks a million I can't put a comment into the public comment to say thanks a million to Stevie and Harun for sharing their story. It's really demonstrative of how this is a real team approach to getting the response right, and teamwork really, really works. So thanks, guys, and thanks, Adam, for organising.
Yeah, I agree too, Fiona, and that's one of the keys to managing infectious disease. Like, you're not alone with these sorts, of infections. And if we want to get control of it in our community, we're going to have to work together and be supportive. And that's very much the way to go. And I think, yes, you guys are just amazing to come on this and tell us about your experience.
And I would like to thank, I'm sorry, Stevie. I'm sorry. I would like to thank all the sexual health doctors, advisors, nurses. Thanks to them, I had a very smooth experience at the hospital, and thanks for all the hard work on top of COVID and all the other budget cuts and everything going around. You are doing a fantastic job to protect us and saving lives, and thank you very much for that. And thank you, Adam, for hosting this.
Stevie?
Just briefly around the conversations that we're having. A few days before I had symptoms, or about a week before I had symptoms, I was having a conversation with someone about monkeypox, and the narrative that I heard from this person was very much, can the gays just stop having sex? I haven't had sex since April. And that was very upsetting for me, for a number of different reasons. So yeah, I would just like to say that this isn't really the right approach that we should be taking. It's too shaming, and yeah, I'd just like to say that. And thank you all for having me here.
Yeah, thank you. Yeah, Fiona, yeah.
I'm really sorry, Stevie, but Adam, so I completely agree with you, Stevie. And we don't say things to people about their cigarette smoking or their alcohol consumption or their drug use when we're assessing them for their heart attack or their stroke. And we're all human at the end of the day. So I completely agree with you, Stevie. I think on this forum, you're preaching to the converted, and our job is to make sure that everybody gives everybody the chance to be themselves. So yeah, I completely agree.
Yeah, thank you. I think that's such an important piece, and how we interact with each other, how we speak to one another. It's going to be such an important part of how we tackle this outbreak. If we have folks that reach out to us and they're doing the hard work to make us aware that they might be contacts of monkeypox, the way in which you respond is really important. We've learned those lessons around HIV. We've learned those lessons around STIs in general. And there's lots of lessons we've already learned that we can put into factor here. But I'm going to leave it on a positive note. I think this has been a really fabulous and really worthwhile hour. My heart goes out to you all, Fiona, Natasha, and particularly Stevie and Harun for sharing their lived experience of it. Eternally grateful for that. And everybody, as I said at the start, for tuning in. It's really, really important that you've all given up an hour of your evening to come in and listen and to understand, and hopefully now go into the rest of the world and sharing what we've learned and bandying together to kick monkeypox's bum. Listen, I'm going to leave it at that. Thank you so much, and have a lovely evening.
Thank you, Adam.
Thanks, Adam. Bye.